Do you want to study medicine in a more interesting way? Then you have come to the right place. My name is Shanima, and today we are going to discuss about Paget's disease of bone. So, let's start by writing here. So, Paget's disease. What do you mean by Paget's disease? Paget's disease is basically an abnormality with bone remodeling. So that is a very interesting terminology. What is bone remodeling? So let's explain the normal process of bone remodeling. So if you think this is a bone, there are osteoclasts. So I'm drawing the osteoclast like this, and then there are osteoblasts. Osteoclasts normally have 5 to 10 nuclei, and then there are the osteoblasts. The osteoblasts do the bone forming, and the osteoclasts do the bone resorption. So, in normal bone remodeling, there is a good balance between osteoclast bone resorption and osteoblast bone formation. So, normally, what happens is if there is a dead and damaged bone tissue which needs to be replaced, the first to come to that place is the osteoblast. So, let's see this bone. So, these are the osteoblasts. All right, and the osteoblast initially releases a substance called a rankle receptor activator of in kappa B or the Wrangel ligand. So this rank will bind to, so here is the osteoclast. The osteoclast has got receptors for this rank L, which is called rank. So the rank L will go and bind to the rank receptors on the osteoclast, which in turn activate the osteoclast, and the osteoclast releases enzymes called collagenases. So the collagenases help in eating away the bone or causes bone resorption. So after a good amount of bone resorption, what happens is the osteoblast produces a substance called osteoprotegrin or OPG, which binds with the rankle. This is OPG. This binds with the rankle and prevents the rankle from binding with the rank receptor in the osteoclast. So the osteoclastic bone resorption is stopped. So now we have got a resorbed surface of bone, and we have got the osteoblast here. So what happens is now the osteoblast will get activated and produces osteoid seam. Okay, this is the osteoid seam, and it is made up of collagen. So this is the osteoid seam made up of collagen fibers. All right. So as you can see, this osteoid seam is laid down in a very systematic manner so that our other molecules like the calcium and the phosphate can bind to this osteoid seam and produce good bone. So this is the normal activity that takes place. So what happens in Paget's disease is, as we said, the bone remodeling is high. So initial phase there is high bone resorption. So what happens with the Paget's disease is, so the osteoclast of the Paget's disease is abnormally large, not with the 5 nuclei, with approximately 100 to 500 nuclei, and they cause lot of bone resorption. So that phase is called the lytic phase. That is phase 1. Okay. Then the second phase, there is osteoclastic bone resorption along with the bone formation by the osteoblast. But the collagen that they lay down is haphazard. So because of this is the mixed phase. So there is osteoclast and then there is osteoblast in the mixed phase. Third phase is the sclerotic phase where majority it is the osteoblast laying down lot of collagen but in a very haphazard manner, which is so the bone formed in the sclerotic phase is highly porous and lacks strength. Then the last phase is the burned out phase. Even the osteoblastic activity is burned out as well. So this is the pathophysiology of Paget's disease. So this is the normal bone pathway, and this is the what happens in the Paget's disease. So if we look at the etiology of Paget's disease, we can think that it can be due to some factors like a gene mutation, SQ1 STM gene mutation, or it can be due to previous measles virus infection. It is mostly seen in males over 50 years of age. Alright, so these are regarding the pathophysiology of Paget's disease. So let's see the symptoms of Paget's disease. Symptoms starts with at the site of this bone lesion, there will be pain. Yeah, at the site of the bone lesion, that is one symptom. The second symptom is fractures, bone deformities, secondary osteoarthritis. So these are the symptoms which are related to the bone. And then let's see what happens to each bony site as such. Okay. So if we go to the skull, let's see what happens in the skull. So in the skull, because of these areas of increased bone resorption and added by increased bone formation, the skull will be abnormally shaped. So that is called leonine facies. So which is evident in this picture. As you can see in this picture, leonine facies. Then the second symptom. So leonine facies, which is evident in this photograph. Another problem that is happening in the skull is because there will be lytic lesions which make it look like a moth-eaten appearance, which is also called osteoporosis circumscripta, which is seen in this picture. So that is the lytic lesions in the skull. This is another lesion of the skull, another picture of the skull showing the leonine facies. So these are the things that is happening with the shape or and the x-rays of the skull. So what there are a lot of effects of this as a type of lesions which causes on the skull. For example, this can cause entrapment neuropathies in the form of and cause compression of the optic nerve, causing optic atrophy. It can also cause compression of the auditory canal, causing hearing loss. It can cause compression of the seventh nerve, causing Bell's palsy. It can cause compression of the base of the skull, causing hydrocephalus. It can cause all these effects in addition to the deformities of the shape and the extra appearance of the moth-eaten appearance of the osteoporosis circumscripta. So these are the things which are related to the skull. When we come down from the skull to the vertebra, what happens in the vertebra is basically lytic lesions and thick sclerotic margins. So the lytic lesions and thick sclerotic margins give the appearance of, in this picture, you can see thick lytic lesions and thick margins. So this is called a picture frame vertebra. And this picture frame vertebra can cause spinal canal stenosis and spinal cord compression and causing weakness of muscles. It can also cause cauda etc. And these all can cause weakness of lower limb muscles. So if you come down from the vertebra and think about the pelvis, the same thing, the lytic lesions and thick sclerotic margins cause what sign with the pelvis to appear like having a thick brim. So this is called pelvic brim sign, which is evident in this photo. So this is the pelvic brim sign. You can see here there is a lot of lytic lesions and there is a thick brim. So this is called a pelvic brim sign. So these type of lesions in the pelvic can cause the pelvis to tilted towards one side. Now when we come to the lower limb, in the lower limb, so the skull, the vertebra, the pelvis and the lower limbs are the most common types of bones involved. And when you come to the lower limb, the tibia and the fibula can be bent and to one side, causing a deformity known as saber tibia. So this is evident in this picture. So this is another abnormality of the tibia, where there is, as you see, there is an advancing lytic. If you see this one, there is an advancing lytic lesion in this bone, in this X-ray. So this is called a flame sign, right? So these are the signs in the lower limb, and there are some systemic effects because of this Paget's disease of the bone, in addition to all these bony effects. So bony effects include pain at the site, deformity, fractures, then secondary osteoarthritis, nerve entrapment, muscle weakness, etc. Because of the other systemic effects include the increased vascularity due for the bone turnover can cause congestive cardiac failure. Second thing, the increased bone turnover can cause gout. Third is increased bone turn. Sometimes, if because of these deformities, if the person becomes increasingly immobile and bedridden, then the calcium can go up and can cause hypercalcemia, and the hypercalcemia can cause kidney stones. Also, it can cause kidney stones as well. So another thing that I forgot to mention when I mentioned about the lesions in the skull is that it can cause prognathism. And in a patient with the dentures will not fit anymore, and it can cause jaw malocclusion as well. Alright, so these are the effects of the Paget's disease. Then we come to the investigation. So in the investigation, in the plain X-ray, we know there will be lytic lesions and thick cortices. Lytic lesions and thick cortices. Then bone scans doesn't provide any additional benefit other than to find out the areas with the lesion. Another thing is CT scan. CT scan is helpful to rule out any kind of added tumors like osteosarcoma. Then if you go to the blood test, there are a few blood tests which point towards Paget's disease. The increase in ALP or alkaline phosphatase, increase in bone specific ALP. But if you look at the calcium or the phosphorus or the parathyroid or the vitamin D, all are normal. Another marker is urine hydroxyproline. Urine hydroxyproline levels will be increased. Another marker is in the serum procollagen N-terminal peptide. Peptide levels will be elevated, and the C-terminal peptide levels will be elevated as well. All right. So, but in addition to all this, so all this, if you do all this blood test, you will have some pointers towards Paget's disease. But if you do bone biopsy, which will give you a definite diagnosis. Next, coming to the treatment. So there is not much cure for this disease other than analgesics, bisphosphonates. Bisphosphonates basically inhibits osteoclasts. Then there are certain surgical options like to correct the deformities, fracture correction, or some doing laminectomy to relieve spinal cord compression. Another thing can be joint replacement. So this, now we have discussed in detail about Paget's disease. Let's try to summarize about Paget's disease in this one Right. So if you think about Paget's disease, this is a disorder of bone remodeling. It has got 4 steps. One is the lytic phase in which osteoclasts are high. Second is the mixed phase where osteoclast and osteoblast are high. Third is the sclerotic phase when the osteoblasts are high. Fourth phase is the burned out phase. So these are the 4 phases of Paget's disease. And when coming to etiology, SQSTM1 gene mutation, measles, males more than 50 years. Right. Now coming to the effects or the symptoms. First, the symptoms we can start with the bone pain. There is deformity. There is fractures. Secondary osteoarthritis. These are the general symptoms. Then we see each system by system. If you think about skull, there is leonine facies on the moth-eaten appearance or osteoporosis circumscripta. Then there is prognathism. Then we have got optic atrophy and hearing loss, Bell's palsy, hydrocephalus. Coming to the vertebrae there is picture frame vertebrae, weakness of lower limb muscles. Coming to the pelvis, pelvic brim sign. Coming to lower limbs, saber tibia. Then there is the flame sign. Then coming to the more systemic features which are more pronounced include cardiac failure, gout, kidney stones. Then thinking about investigations, X-ray, bone scan, CT scan for to rule out osteosarcoma. Then biopsy, which is more definitive. Then blood investigations, raised bone specific alkaline phosphatase, rest calcium, phosphorus, PTH, vitamin D all normal. Urine hydroxyproline is elevated. Procollagen N-terminal peptide is elevated. C-terminal peptide is elevated. Then coming to treatment, bisphosphonates, analgesics, surgical. Surgical include laminectomy, joint replacement, deformity correction. This is in short about Paget's disease.